Cindy, this decision is of significant interest here in Canada as well, which has signed up for this same vaccine. Walk us through the details you're hearing.
Well, Jennifer, this was one of the most promising vaccines. It is much easier to store and handle compared to the Pfizer-BioNTech one that was approved a couple of weeks ago, because this one only requires a regular refrigerator temperatures rather than freezing cold ones. And the Oxford AstraZeneca vaccine is also significantly cheaper. So this is good news for developing countries. Here is that head of the British health regulator approving this vaccine. Take a listen to what she said.
Our teams of scientists and clinicians have very carefully and methodically and rigorously reviewed all the data on safety, on effectiveness, and on quality as soon as they have become available, and have done so round the clock, looking at all the tests and trials, even over holiday periods. No corners whatsoever have been cut.
The question is, how effective will this vaccine be against the coronavirus? Because the Pfizer-BioNTech shot was 95% effective. This one in trials has proven to be 62% effective if given 2 full doses, whereas that shot up to 90% if a half a dose was given followed by a full dose. However, the British regulator has opted to approve the 2 full doses because it says it does not have enough data to go ahead and give the green light to that mixed dose regimen. If you talk to the chief investigator of the Oxford vaccine group, though, he does say what is most important is administering this first dose. Take a listen.
If you give a first dose to as many people as possible, and you don't have to give the second dose just a few weeks later, then you can vaccinate a lot more people with that first dose, stop them getting severely ill and going into hospital. You do still need the second dose, but if you delay that, you can have vaccinated a lot more people.
And the British Health Secretary, Matt Hancock, says it will be rolled out in the UK beginning next week. The country has ordered 100 million doses, which is pretty much enough to cover the entire population. This is just for adults, not for children, not for those 18 or under, because this has not been tested on children. Health Canada has yet to approve this Oxford AstraZeneca vaccine, but if it does, then you can expect about 20 million doses coming Canada's way.